The theme for World Tuberculosis Day 2022, Invest to End TB, Save Lives, conveys the urgent need to invest in the resources to ramp up the fight against TB and achieve the commitments to end TB made by global leaders. Tuberculosis, or TB, is a potentially serious infectious disease that mainly affects your lungs. It's caused by a bacterial infection of the lungs by a bacterium called Mycobacterium tuberculosis. This bacterium is spread from one person to another through tiny droplets released into the air through coughs and sneezes. Medical doctor Francis Martin explained that in Grenada, TB cases have been minimal.
I don't have the numbers of Grenada's exact rate of infection right now, but what I can say is that over the last couple of decades, the incidence or the numbers of TB cases has not really been very, very high. It's only in recent time we have noticed an increase in tuberculosis, and it's primarily driven by co-infections, especially with HIV.
Tuberculosis can also affect other parts of the human body, such as one's kidneys, spine, or brain. When TB occurs outside your lungs, the signs and symptoms vary according to the organs affected. Dr. Martin highlighted some of the possible symptoms associated with the disease. This disease can affect people of any age range depending on one's medical condition.
It's an infection of the lungs, so the primarily type of symptoms they may have would be fever, chest pain, a cough, producing a lot of sputum and so on. However, it's very difficult to use those symptoms to differentiate tuberculosis from another type of lung infection. You really do need specific lab and X-ray investigations to determine if it is a TB or any other pathogen. So we really don't look at the symptoms because all the symptoms that cause pneumonia of the lung can be the same one that TB can show as well.
Further explanation revealed that tuberculosis of the spine may give you back pain, and tuberculosis in your kidneys might cause blood in an individual's urine. Dr. Martin had this recommendation should someone suspect they have or someone else has tuberculosis.
Tuberculosis is probably one of the most infectious agents known to us as humans. So if someone is suspected of tuberculosis, you really and truly have to isolate. You have to put on your mask, just as we do now with the COVID. Putting on masks is extremely important. The issue is it's very difficult for people to suspect they have TB, except if they were exposed to someone who were positive. Then there's a procedure that can go on for you to check yourself to see if you had the infection. If you suspect you have TB, of course, there are treatment available for it.
Christina John, GBN Health.